Let's go back to one more scenario for a review and correct report research. On Friday, November 3rd, Wellville Agency retrieves their review and correct report from CASPER. While reviewing Q2 2017, the agency notes that one patient was not included in the numerator for the drug regimen review quality measure. The agency questions whether this observed performance rate is correct. You can see on your screen the report that we looked at earlier, and you can see the difference between the numerator and the denominator. Let's have a knowledge check. Which report would best assist the Wellville Home Health Agency to identify the patient who was not included in the numerator of the drug regimen review quality measure? Would that be the outcome tally report? Would it be the process tally report, the provider review report, or a quality assessments only interim performance report? Look at that. 91% say the process tally report. And do we all agree with them? We absolutely do, because drug regimen review quality measure is a process measure. And so we would be looking at a process tally report for that specific question. And here we have another scenario. The Wellville Agency runs the process tally report for Q2 2017. They have discovered that their patient, Mr. W., was not included in the numerator of the measure because a tally report is patient-level data. And remember, that is how you're going to identify which OASIS you need to investigate to see if there is an error. To determine why Mr. W. was not in the numerator, the agency wants to review the response values that were submitted in Mr. W.'s OASIS record for the drug regimen review assessment items. If you remember from the OASIS and from our previous trainings, these items include 2001, 2003, and 2005. Let's check what we understand. Which report would best identify the response values submitted in Mr. W.'s OASIS record for the drug regimen review assessment items? Would this be an outcome tally report, a process tally report, an OASIS error detail, or the OASIS assessment print report? We have a very mixed spread across our answers. Which report will best identify the response values for the drug regimen review assessment items? We have a small majority. We seem to be split between the process tally and the OASIS assessment print report. Let's take a look and see what the correct answer is. The correct answer is the OASIS assessment print report. And look at that, we had almost an even split there. You did look at a process tally report first to identify who it was that might have had an error or incorrect data. It's the OASIS assessment print report that's going to tell us which questions and what the values were for each of those three questions. The OASIS assessment print report reveals that item 2001 was submitted with a response value of 1, indicating that potentially clinically significant medication issues were identified for Mr. W. during his drug regimen review. 2003 was submitted with a dash response value, indicating this item was not answered for Mr. W. If a dash is submitted for 2001, 2003, or 2005, then the record would be included in the denominator of the measure, but not the numerator. the agency reviews Mr. W's medical record. They determined that item 2003 was in fact coded incorrectly. On Friday, 11/3, Wellville Agency submits a modified assessment to ASAP for Mr. W. Let's go back and check our understanding of this process again. When can Wellville Agency expect an updated review and correct report reflecting the modified assessment that was submitted on Friday, 11/3? Will that be the next day, Saturday, 11/4, the next Monday, 11/6, the second Saturday of the month, 11/11, or the fourth Saturday of the month, 11/25? Remember when the calculation is done as you contemplate how to answer this question. So when do you think the agency can expect an updated review and correct report reflecting that modified assessment to appear? We have a significant majority who will believe that this will occur on the following Monday, 11/6. And the correct answer is 11/6, the following Monday, because review and correct reports are always done, the calculations are done on Mondays. So that's why that answer is correct. On Friday, 11/10, Wellville Agency accesses their review and correct report, which was updated on Monday, 11/6. The agency confirms that their observed performance rate for the drug regimen review quality measure was updated based on the modified assessment they had submitted the previous week. And here is that report so that you can see the difference here. Let's check our understanding one more time. When can Wellville Agency expect an updated process tally report reflecting the modified assessment submitted on Friday, 11/3? Will it be the next day, Saturday, 11/4, the next Monday, 11/6, the second Saturday of the month, 11/11, or the fourth Saturday of the month, 11/25? Remember that they submitted their modified assessment on Friday, 11/3. And remember what days process tally reports are updated. Click in the circle next to the answer you believe is correct. We seem to be pretty evenly split between the second Saturday and the fourth Saturday. Let's take a look and see what the correct answer might be. And the correct answer is the fourth Saturday of the month. And do we remember why? It's not on a Monday, and it's not the first Saturday of the month. So we know it had to be either the second or the fourth. If you think back to our earlier slide, when we defined what corrections are, what calculations are done and what OASIS assessments are included in the second and the fourth Saturdays, you will understand why this modified assessment was included in the November 25th or fourth Saturday of the month calculation. On Monday, 11/27, the agency now accesses their process tally report, which was updated on Saturday, 11/25. The agency can now confirm that Mr. W is now included in the numerator of the drug regimen review quality measure.